And what this showed was that on average, each of our first 70 babies had been exposed to 3.7 substances each.
Incredible.
One of them had been exposed to 8. So when you think about the fact that many of our babies, methamphetamine withdrawal and withdrawal from opiates look very, very different. So what happens when you have a baby that's been exposed to both? Maybe there's some methadone in there, alcohol or tobacco. It could be things even just as mundane as caffeine or nicotine, antidepressants, those kinds of things. Neonatal abstinence syndrome covers all of those. It's any substance that a baby would withdraw from.
Okay.
So when you have a baby that's been exposed to these very different substances that cause very different withdrawal symptoms, you don't know at what gestational age they were exposed, for how long, in what combination, and then you throw some biology in there. It's an absolute grab bag what you're going to get.
Hi, I'm Kristen Brunius, and this is the Overcomers Podcast. I am so excited for you to hear the stories of incredible people overcoming trials and turning them into triumphs. From everyday moms and dads to entrepreneurs to community leaders and beyond, you'll see how everyone has a story of overcoming, and those stories are what connect us all. Let's hop right in. Hey everybody, welcome back to Overcomers. I am so glad you're here. If you're new here, make sure you hit that follow button and that alarm so you never miss an episode. And boy, you are in for a treat. Make sure you grab your Kleenexes. I just finished recording with Katie from Maddie's Place. Maddie's Place is located in Washington, and they specialize in infant care for babies who are born with NAS, which is addicted to substances of some sort. And while it is devastating and sad, and you're heartbroken for these children, at the same time it is hopeful, and it is full of grace, and it is full of love and full of joy because of the success of the recovery of these children. And I just think it's beautiful. I just think it's the most beautiful thing ever. So I really hope you enjoy hearing from Katie and all that she shares, and make sure you check out their Instagram if you love seeing really cute videos of babies. And also, as you guys know, this podcast is self-sponsored, and so I want to remind you about this great opportunity to try 7 of my favorite Soul Naturals products actually for free. And so we have now available what's called a sampler pack. It is available on my website at soulnaturals.com/Kristen, and it is a pack that's $14.95. You get to try one of each of the drinks, and they are clearly labeled. It's everything from a plant-based protein to a collagen blend to my favorite, Cinnamate, which is for energy and blood sugar balance. We have a drink for hormones, a sleepy time tea, a green drink that's like your vitamins. We have it all, and you get to try one of each, see which ones you like, see which ones you want to continue with. But here is how it is free. There is a $15 gift card in the package, so you pay $14.95, free shipping. It comes to your house. You try them all. You decide what you want to keep. You use the $15 gift card, and you can continue with whatever product or products worked best for you. So go check that out, soulnaturals.com/Kristen. Just hit the shop all, and it's like one of the first options, and I just know you're going to love it. I've been using these products for almost 8 years, and they have helped me in more ways than I can count, and I know they'll help you too. So let's hop right into the episode. All right, so I was thinking about this interview, and so you guys know I love Instagram, and one day I was on Instagram, and I'm just scrolling through, and I see this most adorable account. And I start looking through it, and I'm like, what is this? They're taking care of babies? This is a place for babies where people get to cuddle babies? And as I dug a little bit deeper, I discovered that Maddie's Place. So we have Katie, is it Tolley?
Yes.
Katie Tolley from Maddie's Place. And I just do this thing where if there's Instagram accounts that I just really love, or people that I love following, I send them a little message like, hey, I'm a small podcast, and would you be open to me interviewing you? And the amazing people at Maddie's Place said, yes, absolutely. We totally would. So this is how we ended up here. And you guys are going to hear all about Maddie's Place and why I fell in love with their Instagram account and their mission and everything that they're about. And I know I say this every week. I know I tell everybody, I'm so excited. I'm so excited. But for real, from the moment you guys said yes, I was like, this podcast is going to make an impact. And it's going to make an impact for babies and families and communities and so much. So, Katie, thank you for hopping on. So appreciate it. I know I'm outside Chicagoland. You're all the way in Spokane. Did I say it right?
You got it.
Spokane, Washington, but this is not a cause that is, just for Washington. This is
Mm-mm.
needed so many places. So it's an honor. Thank you. Thank you. Thank
Oh,
you.
thank you for having me.
Yeah. So I gave a little bit of a teaser that Maddie's Place is all about babies, but it's so much more than that. So why don't you tell us a little bit about Maddie's Place, how it started, what your mission is, and all the things.
Wonderful. Well, we here in Maddie's Place are what is known as a pediatric transitional care facility. So, what we do is provide medical care in a nurturing environment for infants that have been exposed to substances before birth. And we do that together with really loving wraparound support for their caregivers. So, our founder moved from the Chicago area to Spokane here about 25 or 26 years ago. She is a nurse by trade, has worked labor and delivery and high risk antepartum care, and sort of got this reputation in our community as the baby lady. Our city was really struggling and starting to see increased numbers of infants that were exposed to substances before birth, and not really understanding that was something a little bit new. There were different substances babies were being exposed to, and our medical community was kind of struggling with the increased numbers and how do we care for them. And so Trisha would often get calls. She and her husband became foster parents. They've got four biological children of their own, but became foster parents and started fostering these babies with medically complex needs and what's known as neonatal abstinence syndrome. That is what we treat here at Maddie's Place, and it's the collection of symptoms that babies will experience as they withdraw from substances. Trisha and her husband went on to foster nearly 30 of these babies and
Incredible.
ended up adopting five of them. So they had four of their own and adopted five. And,
So
for
nine
months,
children.
nine children,
Nine.
yeah, working, both of them working. Yeah, they're just incredible people. And, just what Trisha was doing innately, just sort of figuring out what these babies needed. There wasn't a handbook. And, she was a nurse, she'd had training, but um, this was so much more complex. And so she, for some of them, would need to sit, she would sleep upright with them in a Moby wrap or holding them for 6 months at a time. These little babies were going through such horrific withdrawals. And uh, After she and her husband had moved here to Spokane, they met Sean Cross. He is our president and CEO. He's a lawyer he's an attorney by trade. And, they just built this really beautiful relationship. And back in 17, she approached him. She and Carrie, had just decided that they couldn't do this on their own. They needed to bring more people into this work and teach other people how to do this. And so they approached Sean. They had an idea for a nonprofit. They wanted to start a small nursery where they could care for maybe 6 or 8 babies at a time that were struggling with neonatal abstinence syndrome. And so brought Sean on and asked for his help trying to create this nonprofit. And so he did the paperwork and, helped found Maddie's Place. So we were founded in 2018. We received our nonprofit status in 2019 and then had the opportunity to start fundraising and actually buy the building that we're in 2020. Um,
Oh, so it's very new.
well, yes. So we're only about 2.5 years old, and I don't know whether it's unfortunate or, maybe fortunate, but in early March of 2020, uh, they started fundraising for Maddie's place. And then the pandemic hit. And, what were they going to do? We needed to raise, hundreds of thousands of dollars, millions of dollars to get this place started. And so Sean pulled in, a lot of his contacts that he had here in the region. And Trisha was caring for a baby at the time named Sawyer that was a really, really difficult case. Um, she had been, she was very, very small, very tiny. Her mother was obviously struggling with substance use, and gave birth to her at home and laid her on the couch and called 911 and was trying to clean up all of her drug paraphernalia before the paramedics showed up. In the meantime, little Sawyer had multiple aneurysms and was in the hospital for quite a long time. And um, by the time she'd gotten to Trisha, she had nearly died. Was in the hospital for several months, but Trisha was holding Sawyer, on these Zoom calls, meeting with folks in our community that were obviously, drove through our city and saw folks struggling with substance use just openly. But I think it's something that people recognize that adults may struggle with that, but they never or very rarely think about the other people impacted by that there are children and infants impacted by substance use. So it really just kind of came as a surprise. And so we got really lucky. We had a chance to buy a building. It was the former Vanessa Behan Crisis Nursery building. So it was a nursery for families that were struggling, kiddos that were at risk of abuse, that it was a 24-hour facility. Parents could drop their kiddos off if they needed a break, didn't have somebody else to care for their kids. They had just built a brand new building a few minutes away from here, unfortunately needed a bigger building. There was a need for that in our community. And so we bought this beautiful building in the South Perry neighborhood. It's a residential neighborhood here, but very, very close to a lot of amenities that our parents staying here at Maddie's Place need to utilize. Um, PCAP that can provide, they work with families, I think, up to the age of 5, kiddos until they turn 5,
What is PCAP?
providing PCAP. I will look at that. I know the acronym.
Is
Um,
it a social service sort of thing?
yes.
Okay.
So they will work with families to provide transportation and concrete goods. Let's see, Parent-Child Assistance Program.
Mm, got it.
It's a sort of a paraprofessional home visitation program for high risk, parents that are using, have substance use issues. So they're going to be there to support families with whatever, concrete goods or support services they need, that kind of thing. So we work very closely with them. We try to get all of our families connected there. So it's just one more support in the community, in addition to us. And then community minded enterprises is another one. Partners is another one that offer group and therapy for parents and that kind of thing. And they're all within walking distance of our building here. So um, yeah, so our model is unique. It's not what's currently being used in our hospital systems. Typically, a baby that's been exposed to substances will be admitted to the NICU. They'll be placed on morphine, which is another opiate, and weaned off of that morphine to get them through their withdrawal. We use what's known as a non-pharmacologic model, and it's based off of a study that was done between Johns Hopkins and Harvard University, or Harvard Medical School, that was released in 2021. And I think it's rather than a morphine first model, it's a morphine last model.
Got it.
What this model focuses on are really specific care techniques, handling techniques, and feeding techniques. Much of what we do is one-on-one care here with these babies. to make sure that we are addressing, recognizing their cues of dysregulation, and trying to meet those needs, um, and soothe them and get them regulated so they don't get so dysregulated that they get overwhelmed and end up needing the medication, feeling pain, that kind of thing. And so we are actually one of only, a lot of that is what Trisha was doing just naturally. And
Right,
then come to
right.
find out it was, proven by this study. Um, and so we're actually, while there are, some clinics around the country that are treating babies, treating infants with neonatal abstinence syndrome, we are one of only 5 in the country that
Let me share
utilize.
my screen to show
Yeah,
everybody that.
we are one of only 5 in the country that we know of so far that are using a model similar to this, where we recognize the importance of the parent being involved in this care. And what this study talks about is how important it is, and on a physiological level is healing for both parent and baby to be together and bonding, to be regulated. Um, I don't know if you can see slide number 11, um, but it talks about this window of tolerance. And
Tell
our
me
goal,
tell me when, because I don't know if
sure,
we have a number.
keep going.
Sorry about that.
That's okay.
Is it this
Next
one?
one.
Okay.
Next one. Yep. There we go. Um,
Yes.
so what we're trying to do is get parent, and it, hopefully biological mom, um, is where we're going to have the most impact. But get both parent and baby co-regulated,
Hmm.
where they find this window of tolerance where they can bond. It's really, really important, this bonding in the first, critical weeks of life, 30, 60, 90 days of life, um, where they're not so overwhelmed that they're, in this hyper arousal state, um, sort of flooded with these intense emotions, really feeling overwhelmed, or where they're so overwhelmed that they just completely shut down.
Right,
Some of
right.
the babies that we see, will come in and they experience severe tremors. They have a really difficult time processing sensory input, so light, sound, touch, those kinds of things. They struggle with feeding, um, and or they'll just be so overwhelmed that they completely shut down and they look like they're sleeping for days or weeks at a time,
Hmm.
depending on the substance that they've been exposed to. And so, our whole goal is to wrap parents in love and non-judgmental support so that they are, in a good place where they can focus on bonding with their baby.
Yeah.
Um,
Yeah.
so
When I was looking at this, I know that this is particularly for your niche of, babies born with, what's the proper term?
it's called neonatal abstinence syndrome. We
Okay.
call it NAS for short. You might hear NAS,
NES.
or substance exposure.
Thank you. Thank you. So I know that this is specific to NAS. However, as a mama myself, and I'm sure you feel this way too, like I wish somebody would showed me this, like because I don't know for sure that I had any postpartum with my first or really with any of them, but I definitely was super anxious. And so I was looking at this chart as a caregiver and I was like, I definitely was overwhelmed and I definitely
Yeah.
was defensive and overreacting. And then my child would then respond with those, maybe not to the extreme. And I wish somebody had told me that. So I feel like this applies no matter who you are,
I
right?
absolutely agree. Shortly after I was hired, if I was going to be out in the community talking about this work, I really wanted to understand it. I wanted to understand what our caregivers were doing, why we were doing it, what was different about this, and why it was, making such a difference. And so I actually started going through the training that we offer for our infant care specialists before they're able to work in our nursery. And this was one of the things that we talked about. And I just had no idea. And I said, I really, really wish that as a first-time mom, I would have had access to this.
Yes.
I went, I've just on a personal note have struggled with depression since I was about 12 years old. And, so when I had my first child, I was very, very aware of, I was on the lookout for postpartum depression. I had no idea that postpartum anxiety was even a thing.
Yes.
And
Yeah.
so, I remember just thinking, my child went through this period for a long time where I just felt like she didn't like me, she hated me, I didn't know how to meet her needs. Um, and if I had had some of this, if I'd understood my needs and what was going on with me, I'd never experienced anxiety, so I didn't know the signs and symptoms to look for. And if I had been looking back, if I feel like if I had been regulated and been more aware of sort of my triggers and how to deal with that, I could have helped her better.
Yeah.
So
Yeah.
yeah,
And our
yeah,
and our kiddos, they feel what we feel. And even when I'm looking into the hypoarousal, once you come down from that hyper,
yeah,
then you're tired, you're exhausted,
yeah.
falling asleep in the toy room, playing with the kids. Like now, let's amplify it even more, and we're dealing with addiction and kids that are withdrawing. This is beautiful.
Well,
I
and I little story, I shortly after I was hired, I try to start or end my day in the nursery or pop back there and spend at least a few minutes every day. I love just number one, I get to hang out with my incredible coworkers and see these beautiful babies and connect with parents and that kind of thing. But it really grounds me in the work that we're doing. And so shortly after I started, I was back there and someone handed me a baby and this beautiful little girl. I was sitting in a chair and she was making this really intense eye contact with me. And I just couldn't look away. She was so beautiful. And, that's one thing often with babies with NAS, in the beginning have a hard time making eye contact and that kind of thing. And so she was just fixated and wouldn't break her gaze. And pretty soon she started to yawn and then she would sneeze. And one of the one of the infant care specialists said, that's actually a sign of her getting dysregulated. She's having a hard time processing the intense eye contact and your face and that kind of thing. Give her a break, look away for a few seconds, and then come back. And it's
mm,
things like that that most people would have no idea that that's a sign or a symptom. You just want to look at this beautiful little baby. But, when our staff and our parents are keyed into those kinds of things and they can recognize those and then address them, it helps that little baby heal.
that's so interesting. That
Yeah.
and I come from the holistic world. That's what I do for a living. And that I just find that so fascinating because we think of like sighs and yawns and those sorts of things is like the body, it's trying to calm itself down, and we
Yeah.
don't. How did we miss that in our babies? That our babies do
Right.
that too.
Right.
Which brings up a question. So tell me and the audience a little bit more about what are some of the things that you see. So you talked a little bit about they have a hard time regulating. Tell us a little bit more of what you see in these infants.
Many of them will come in with and struggle with issues around feeding. Some of them will have mouth deformities, tongue ties, lip ties. One of the things that I found interesting was that, we have this ability when we're first born. It's this reflex to suck, swallow, then breathe when eating, and that becomes volitional around 3 months. And so if we don't, you know, help these babies get that rhythm figured out and learn how to do that, um, that goes away and they can become really dysregulated and be really disorganized in their feeding later on. And down the road, that can lead to struggles with nutrition and only eating certain foods or malnutrition, those kinds of things. It can look oftentimes like suck, 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 try to breathe, then swallow. They're choking, they're getting um, anxious and panicking, and that kind of thing. So we work a lot around feeding. Um, Many of our babies will struggle with tremors, and flailing of arms and that kind of thing as they're going through with their withdrawals. So it makes it difficult to rest. They will startle themselves. So we do a lot of baby wearing. If it's if baby's getting really dysregulated, we will do skin to skin. We keep them wrapped a lot of times. Sometimes they'll need that as they're eating, or it just keeps them. We'll keep them swaddled as they're sleeping, as long as they're being monitored and watched in the nursery. If we lay them down, oftentimes we'll use like a little rice bag that's a little bit weighted over them to make sure that they feel like they're being held and calmed. It's sort of like a teeny tiny weighted blanket. Yeah, lots of kangaroo care, carrying and that kind of thing. Um, Again, those special feeding techniques will do side lying, where it's not, sort of a typical baby. You can prop them up and give them the bottle.
Mhm.
And, with these little ones and with our foster baby, that's one thing we have to do is lay him on his side and adjust the bottle so that it's not just pouring down his throat or trickling into his mouth. That he has a chance to take a break. We can sort of tip the bottle back and pull the milk out of the nipple of the bottle. If they need a chance to sort of breathe, they cues them to take a breath or to swallow. Um, in our nurseries, I would love. I wish I could take you back there. I should have maybe thought about doing our interview in there today, but our nursery, we've got a recovery nursery and then our transitional nursery. Recovery nursery is where our infants and parents will come when they first come to Maddie's place.
Okay.
And we keep the light very low. It's very dim in there, lit with small lamps and that kind of thing. We keep it very quiet, and that's to reduce as much additional external stimulus as we can, so that baby isn't having to process anything additional.
Well,
Maybe when
contrast
we're
that with like the NICU. Loud, beeping, bright
yes, and so
lights.
that's actually sort of part of our argument. We'll talk about that. I'd love to talk about that here in a minute. Is God bless our NICU doctors
Yeah,
and
yeah.
nurses. But even they will tell you it is not a calm, quiet, peaceful environment. Babies are oftentimes in, incubators or isolettes. The staff doesn't have time to baby wear them and do the one-on-one care, and um, can be a noisy environment, very stimulating and that kind of thing. And so that is where we're really trying to build relationship with our hospital systems, our doctors, our nurses, because this is different than the model of care that they're currently using, and encourage them that, to release baby at the same time, if there aren't comorbidities. If there are comorbidities, we need and want baby to stay in the NICU with that specialized care. But I'm going to put this in quotations. If it is just neonatal abstinence syndrome, even if it is severe withdrawal, even if baby has a feeding tube, our staff can handle that. We have a medical director. We have a nurse that is on every shift. We have infant care specialists that have been specially trained. We can handle those things here. We can treat those things here. And the sooner that we get them here in this really peaceful environment with this, one-on-one care, bonding, hopefully with a parent that has come with them, um, we have better outcomes. We are seeing better outcomes for our babies. We're seeing better outcomes for our parents. Um, and so that is definitely something that we are trying to stress and share with our medical community is the sooner that we can get them here, the better off we feel like baby is going to be. And we actually have some study data that is showing that. I'll talk about that in a minute. So,
Love that. Love that. And
yeah,
I was just thinking to myself, like, this has become a consistent theme on this podcast. Covering these various topics from Down syndrome to abuse to, I'm trying to think the last few episodes, just changing the narrative of
yeah,
what treatment could look like,
yeah,
what these in the case of this mom of a child with Down syndrome, like what that narrative is, that it's not the end of the world, that
Yeah.
there is hope and there's a lot of joy, you know?
Oh my gosh.
Um,
I
yeah,
had been working for another nonprofit. I came to Maddie's place about a year ago, and I had been working for another nonprofit that specialized in trauma recovery. And I had
yes,
somebody ask me, like, that is really hard work. Why would you want to go from one really awful thing to come, be here with yet another really terrible experience? People are suffering. And I said, you know what? It's actually so beautiful. I feel blessed. I will be honest and say this feels like one of the biggest blessings of my life to get to be part of this work. You get to see these babies and these parents healing and, changing the trajectory of not only this baby's life, but the parents as well. It's a blessing.
yeah, yeah. And I could feel the passion, from the minute you popped on the screen. And this was the girl. We had a little time change. We'd forgotten about the time change. She was going to let me interview her at 6 a.m. And when I said that, why didn't you, I hadn't like comprehended the time zone difference or whatever. And she said, well, I just want to tell everybody about it.
Yeah.
Like, no matter what time. I was like, girl, we don't have to do this at 6 a.m. Like, we can.
I appreciate the adjustment. But yeah, this is my favorite part of my job. I'm the our director of advancement and marketing here, so I'm doing a lot of fundraising, working with donors and writing grants and that kind of thing. But talking about this work, giving tours of our facility, is just is it's my favorite. So
It's beautiful. So let's circle all the way back because we as we do we we went on a tangent. I was
yeah,
trying to turn that into a verb. Um, so a lot of feeding stuff, startling,
yeah,
tongue ties. Now, this may be like a really dumb question, but are these babies experiencing a lot of pain as they're going through withdrawals?
that is something that they absolutely can experience. That is true. So, um, I don't know if it would be helpful. The slide just before the window of tolerance one,
Yes.
that talks about the Hopkins assessment tool. That is something that is referenced in this study and that's used. And that's an evaluation tool that we use as part of our care here. And what this does is sort of traditional approaches in you know it, to score. We use scoring in like in the hospital systems. They use scoring systems to see um, sort of measure how baby is doing, and they use most times sort of signs and symptoms that are classically linked with neonatal abstinence syndrome. And then they base, the need for medication on the scoring. Unfortunately, those approaches, we feel like are based on sort of a more limited scope of the infant's functioning and don't always result in a individualized or specific non-pharmacologic plan of care for baby. So we look at these four different what we call domains: autonomic, motor and muscle tone, state control or attention, and sensory reactivity. And what we feel like this does is look at other ways of measuring how a baby is handling and adapting to dysregulation or their maladaptive coping strategies. So rather than looking at like just ounces fed or minutes crying, or the need for medication and that kind of thing, we're looking at these other domains, to see how they are doing.
I
And
love
so
that.
it
That's such a holistic
yeah,
approach.
yeah, it takes, I feel like it sort of takes what's being done and takes a little bit of a zoom out, and we look at some other factors.
Hmm.
Yeah.
Love that. Love that. Hey guys, interrupting this episode with Katie and Maddie's place. I know you probably want to be holding and cuddling with these precious babies right now, but I'm interrupting you to remind you to go to soulnaturals.com/Kristen. Click that shop all to check out the sampler pack. It's a great opportunity to try all 7 of our drinks. You never know. Maybe the protein will be your favorite, or the Excel, or the green juice. You never know. Go there, check them out, and then use that $15 gift card to continue with whatever one is the best fit for you. So here's your reminder. Go check it out, soulnaturals.com/Kristen, and let's hop back into this cute little episode about these amazing babies. All right, let's go to, I wanted to talk a little bit about the people at Maddie's place. So tell us a little bit about that.
They are amazing. So we have a staff. I actually need to update this slide a little bit. We are closer to about 85 employees, and most of our staff are registered nurses and infant care specialists. Not everybody works full time. Many of them will work part time and they work elsewhere in our hospital systems here locally. Um, so our medical director is coming in and he's doing assessments on our babies and that kind of thing, and he's directing their medical care. And so our nurses, they are the ones here every day. They're doing they're using the Hopkins tool to do assessments. They're, if medication needs to be administered, they're the ones that are doing that. If baby's on a feeding tube or something, they're helping get baby, hooked up with their feeding tube, and sort of taking care of the medical portion of baby's care. Outside of that, our infant care specialists are the ones that are doing the majority of the day-to-day one-on-one care. So they don't need any special education or certification or anything, because what we do is so specialized and so new. We do that training in-house. And so they're going to go through several days of classroom training and then one-on-one, in-person training in the nursery, learning special techniques and practicing those with another skilled ICS. And what they're also doing is working with parents to make sure that they are comfortable, recognize the signs and symptoms their baby may be experiencing, and teaching them the things to look for, and then how to support their baby and nurture their baby and meet their baby's needs, so that by the time they're ready to exit our program, they are feeling comfortable and confident. They're not panicking or don't understand why their baby is crying and hauling them off to the urgent care or the emergency room and that kind of thing. So it's, yeah, I just love that. And then I don't know if you can show that picture maybe one more time. I love talking about our family advocacy team. And again, that is one of the things that is unique and special about our model of care, is the fact that we are including parents in our model of care. They are very, very important to their babies, meeting their babies' needs and being here to bond. So we have our family advocacy team. The lovely lady there in the center with her hair up is Carrie. She actually just transitioned off of this team recently to become our one of our nursery managers.
Mm.
So she's actually sort of there to bridge the gap. She's worked on our family advocacy team. She's worked in our nurseries and sort of bridge any gap or siloing that may be happening between those teams to make sure the baby's needs are being met, that we have that continuum of care, that there's no gaps or miscommunications. The gal to her, it would be our right as we're looking at her left, is Kim Dunham. She is our social worker, so she is leading this team. And then the other folks that you see in that picture are our peer support specialists. They are all folks that have lived experience. They are all in recovery themselves, everywhere from between, I think, about 20 months and a little over 8 years.
Oh, that's
And
beautiful.
4 of them are actually alumni parents whose infants stayed here. Some of them stayed here, some of them didn't, but all of their babies stayed here. And they have this really unique and very, very special ability to connect with parents that are coming here for the first time, that are here in our visitation center, that, are considering coming here, that are terrified.
Yeah.
They don't have good support systems. They think, their babies are going to be taken away from them, and are terrified to get into recovery themselves. And So this team can say, hey, I've been there, I've done that, I've experienced that. Let me share a little bit of my experience and help walk you through this. Um,
That is,
David there on the far right was, his dad left their family, abandoned their family when he was, I think, around 2. His mom kicked him out of the house at 13. He was using heroin and addicted by the time he was 14, and he was an IV drug user for 19 years.
oh my
And
gosh.
he shared that, he had tried every program, every treatment, he tried to go to detox. He had tried so often to get clean, and he just had never been able to be successful with it. His partner is standing there next to him. That was when she was pregnant with their second baby. And with their first, they were still both actively using. And their first baby was able to come here, and that gave them the time and space they needed to go get healthy, go to detox, to find the supports that they needed. Our team wrapped around them, got them connected, and now, 20 or 22 months later, they have gone on to have their second baby. Kayla was clean and sober through that pregnancy.
Beautiful.
They both work here. Kayla has worked as an ICS in the nursery. They're both working on our family advocacy team. They've gone on to, they have a car and a house. And, David's got 2 older boys, and they are just the absolute epitome of an example of what
Yes.
can happen. Kayla was a very successful business owner. She was an esthetician. She had a great career and was making good money. We've had parents here that were social workers, that, this isn't something that just happens to bad people. It's, I think that we really have got to shift this narrative that it happens to people that don't have value, that aren't contributing something to our society. This can literally happen and impact anyone. And
Yes.
so, David there with his long hair and his face tattoos, when somebody comes into visitation and is still actively using, and, he can say, let me share a little bit about my story or my experience. And let's get you connected. We can make a referral to detox.
That's
And on
beautiful.
several occasions, we've had parents that have decided, okay, this is it. We've had parents that have lost multiple children previously into the foster care system. Their babies have been taken away. And we've had parents that have come here, they've gotten clean, they've been able to go back and regain custody of their previous children, keep custody of their baby that's here at Maddie's place. That is the whole goal. We do not want to take babies away from their parents. The best case scenario, parents get into recovery, they get the support and have access to the resources they need, and they get to keep their baby.
So a few questions, well, lots of questions popped up in my head as you were talking. Okay, so how do the kids get paired up with Maddie's place? And do so when the parents bring their child who is struggling with NAS, um, do most of the parents then go into rehab? Are there chances of them being incarcerated in some
Yeah.
sort of so tell us a little bit about the parents. And then I read when I was going through your material that sometimes the parents stay with the kids. Is
Yes.
that just like a temporary thing? Like you can stay with the child for like, on occasion, or do they kind of move in? Like, tell me a little bit more about the parent sort of thing.
Yeah. So most of our parents come from, they've received a referral. Somebody has at the hospital, it might be a social worker, it might be a nurse that says, hey, have you heard about Maddie's place? We love when parents that haven't given birth yet have heard about us and they decide to come for a tour early,
Okay.
and they get to come meet our staff, they see our facility, they get to see what they would be stepping into. But most often it's after baby has been born
Okay.
that we're getting a referral. It may be from their PCAP worker, it may be from their social worker. Just, but they're also able to self-refer. Just pick up the phone and give us a call. There's no, we'll talk about this in a minute. We're not currently covered by Medicaid. We're
Mm.
fighting really hard to make that happen. And so there really are very few barriers to, if any, to parents getting to come here.
Do they
Um,
pay at all? Do they pay
no,
anything?
all of our
Okay.
services are offered free, completely free. We offer parents free room and board, one parent at a time, as long as they are willing and able to get into recovery, meaning they have to be able to provide a clean UA, can come stay here with their baby at Maddie's place. So if there are two parents involved, or if a parent is not ready to get into recovery, is still actively using, we have a visitation center here at our clinic. We've got 5 private visitation rooms. We're open 6 days a week. Parents do not need to make an appointment. They get to show up when they're up and ready for the day. They get to stay however long, for as long as they want, as long as we're open. We just call up to the nursery and have baby brought down, and it's supervised visits. We ask all parents, using or not, to wash hands, to wear a scrub jacket, just so that we can protect baby. If there are other family members, aunts, uncles, grandparents, other siblings that would like to come visit, that's a space that they can do that as well. So, yeah, many of our parents, so those that are staying, one parent at a time gets to come stay here with baby, and they get to stay as long as baby is admitted here. So they can't, if baby needs to stay in the NICU or something, we can't bring parents in yet before baby is born. But as soon as baby gets here, parent can come.
Okay.
Yep. And so we've got 13 private rooms. It's both of our nurseries are sort of this living room in the center, and then the private rooms sort of around the outside. So our recovery nursery has 5 private rooms. Our transitional nursery has 8 private rooms. And that's a space they have their own bed. There's a crib, a bassinet, a rocking chair, a dresser. They get, that's their space. We really, again, I wish I could take you back there and show you around. I'll maybe see if I can share some photos, but um, we don't want it to feel like a clinic or a hospital. We want it to feel more home-like.
Yeah, from
Um,
what I've seen on social
yeah,
media, it feels like you're in a house. I mean,
yeah,
you could tell there's some medical equipment here and there, but it feels almost like you're in a church nursery or like someone's giant living room. But
yes,
I could tell from what you've shared, it seemed like there was a center living room and then the rooms
yeah,
around. And that's a
yeah,
beautiful setup.
yeah. I love to hear, on occasion I've heard a parent say, "Hey, I've got to leave. I've got to go to group or, therapy or something like that, or I have to go to court, and I'll see you guys when I get back home." And that, I stop
Yeah.
in my tracks. I love hearing that. We want to be a home away from home while they are here. And that's something else, a lot of our parents will come to us homeless. The majority of our parents will come to us homeless, without jobs, without transportation, without ID. They are justice system involved. They have a ticket or a warrant we need to deal with. Um, the oftentimes with long-term drug use, they have really awful dental issues that we need to get dealt with, and so they're only here for a short time and have to go have all of their teeth pulled. We've got to get them signed up for this slew of services, WIC and PCAP and ESIT and all of these things. For a mama, her body has just gone through something really traumatic. She's given birth and she is healing. And by the way, she's brand new in her recovery too. So maybe, if she's on medically assisted treatment, getting those dosages figured out and
Right,
trying
right.
to step down off of that. And so isn't going to be feeling good for a while, or maybe really sleepy for several weeks. And, so when you think about all of that, and then our system and our society is saying, put all that aside. We need you here. The most important thing you can do is be here and bonding with your baby. And for those of us with a good support system and resources, dealing with all of that can be really, really overwhelming. So when you ask a parent without the support system, without the resources, maybe, they've come from out of state, or they're coming from across the state, they don't live here in our Spokane region, um, asking them to do that can be nearly impossible. And so that's where our family advocacy team steps in, or our, infant care specialists and our nurses step in and say, we're going to, for these first couple of weeks, step in and we'll take baby overnight. We'll do baby's cares overnight. You go get the rest you need. Or if they're sick, they're not feeling well, we're going to do this feed. We'll make sure to wake you up for the next one. Those kinds of things. We are here to help parents address literally any barrier that they have to getting and staying in recovery, to getting to keep their baby and being happy, healthy rock star parents.
That's beautiful. That's beautiful. And
Yeah.
that's what we should be as communities, right?
Yeah.
We should be helping these new parents, and especially when they're in need like this. Yes, I know that it, there was a choice at some point, but we
Yeah.
all make choices, right?
Yeah.
And let's bring them out of that, support them, help them to be the best moms and dads that they can be.
Yeah.
Um,
And you
yeah,
never know what trauma or poverty or, you know, there's a laundry list of situations that, have led people to this point in their life. And so we are just here with loving, non-judgmental care. We don't care. We can't change the past. We're going to meet you where you're at. We're going to move forward from here and make sure that you have what you need to be happy and healthy.
yeah, yeah. And I wanted to kind of transition. I was looking at this presentation and just talking about Washington in general brought up some questions I had. And where is it? So here's where you talked about it's 56% homeless, some of the
Yeah.
services.
I've seen that number as high as 87% of our parents have been homeless. And so we try to make sure that we get everyone connected with um, with housing before we leave. Oftentimes, so um, this is a great way to transition into this. Oftentimes our babies, babies are ready medically to be released before parents have had the opportunity to find safe, stable housing. So, WSU did an independent study of our outcomes, and what they found was that, average stay for baby um, in our first about 2 years was around 56 days. Some will be here much shorter, some much longer, but average was about 56 days. So, if you think about that laundry list of things I talked about for parents
Right,
to get
right.
dealt with in less than 60 days, is really overwhelming. So,
Yeah. I mean,
uh,
just thinking about having a baby
yeah,
60 days later, and then let's go back to that list. Where was it? Right here. So these are all the different, you know, organizations that you are with, but
yeah,
you know,
services and organizations that we help make referrals to. So, uh, while we are licensed here at Maddie's Place, we are licensed to offer services for infants up to the age of 12 months. So we are not doing, SUD treatment or something like that for parents here. But what we do is facilitate that. So we partner, we make referrals to community partners and make sure that they have access and are getting connected with services in our community that are already offering really, really great, treatment and therapies and that kind of thing. So we are looking at getting our behavioral health license and that kind of thing. But for right now, we're facilitating parents getting access to and staying in treatment. And, if that's transportation back and forth every day to the methadone clinic, if it is, transportation to and from uh, group therapy and that kind of thing, we will do that. We make sure that they get connected with PCAP, and their PCAP worker will come
mm,
here and pick them up and take them where they need to go, or um, that kind of thing. So yeah, really just making sure that if they need to go to a follow up doctor's appointment or something, if baby has an appointment somewhere,
yeah,
um, we're
that's
getting that. We bring in, that's one of the things we bring in. We've got feeding therapy, occupational therapy, physical therapy. Those providers all come here to our nursery at least twice a week to work with babies to make sure that, we'd like them to stay here and not have to leave as much as we can. Um, so really whatever baby or parent needs, we want to try to help get them connected with those services.
yeah, yeah. And then just to reemphasize most of the time because babies are fragile, but kids in general, they just recover from things so quickly. And adults, we come in with all of this, years of experience and traumas and garbage and
Yeah.
addictions, and we take longer in general just to recover. And so if the average baby stays 56 days and you're trying to cover all of this laundry list of things, I could see how
Yeah.
that could be a giant challenge.
Yeah.
So let's skip ahead to talk a little bit. I found these statistics to be really interesting and uh, claiming total ignorance. Is it 340 times higher in your area? What's going on?
That is a really good question. Um, so what we've sort of been able to figure, a lot of times things will start on the East Coast
Mm,
and they sort of transition across the United States and land on the West Coast. And so, where the rest of our country are seeing rates of neonatal abstinence syndrome and substance use disorder tick downward, we are actually in Washington State seeing those increase. So I'm going to back up just a tiny bit and talk about why we even exist in the first place. Um, there's not a lot of research and good current data around the rates of neonatal abstinence syndrome. And so if you go to the CDC's website, their most recent statistic estimates that 6 in every 1,000 live births will be impacted by substance use. We think here in, at least if we back up about 6 months, we were thinking here in our region, it was closer to about a third of our live births in our region were impacted by substances.
a
So
third.
on a third,
Wow.
33%, yeah. Um, but we didn't have great current data to back that up. It was sort of anecdotal. Um, and we have here in Spokane County anywhere between 5,700 and 6,000 live births. So that's up to 6,000 kids, or excuse me, 2,000 kids a year that could be impacted by substance use um, or substance exposure. And so we thought when we opened our doors in October of 2022 that our services would be covered by Medicaid. And we got about 5 or 6 months in, we'd contracted with local Medicaid providers, and the healthcare authority here in Washington state came down and said, cancel the contracts. You're not being reimbursed for your services. This is not covered by Medicaid here in Washington state. And we took a hot second to panic and go, what? And we were involved back in 2018 in something called the CRIB Act, which ended up being part of something called the Support Act. That was a piece of federal legislation that amended the federal component of Medicaid to cover services provided by pediatric transitional care facilities. So the federal component of Medicaid was there. Unfortunately, what we didn't realize is in Washington is considered a wealthy state, and so federal Medicaid only covers half of the cost. And so
Okay.
it's up to our state and our state legislature or healthcare authority to match the other 50%, come up with the other 50% of that cost. And even though our healthcare authority, our Medicaid here in the state of Washington covers chemical dependency services for youth under the age of 18, the way that that was being interpreted was that once babies were released from the hospital, there was no longer medical necessity for services like ours. We had a very different argument. If you talk to any parent, any caregiver, any doc or NICU nurse, I would venture a guess that they will disagree with that. Depending on the substance that baby has been exposed to, they may not even start withdrawing from that until after they've been released from the hospital, or they will continue to go on to experience withdrawal symptoms for weeks or months, or complications from that, feeding issues. Um, And so what our argument has been was that if we can get baby here out of that very busy NICU environment, get them here bonding with their parent, we're using our specialized techniques and model of care, babies' outcomes are going to be improved. We
Yes.
can address this at an earlier stage with better outcomes for baby, better outcomes for parents, at a a fraction of the cost of what it's costing to keep babies in the NICU separated from a parent. And so, unfortunately, we didn't have good data to back that up. And so, we were lucky enough to work with he was Representative Marcus Riccelli at the time, now Senator Riccelli, who went to the state legislature and advocated on our behalf and said, "Hey, I think this is something special. I think Maddie's Place could be onto something," and was able to secure $5.5 million for us
Incredible.
out of our state's opioid abatement account. So there was a national opioid settlement from big pharmaceutical companies. I think it's in the upper 50, $57 billion over the course of the next 17 years. Every state in our country is going to get a cut of that. So of Washington's portion, Washington State, I think, gets about half of those dollars. And then the rest will be divided up between the municipalities. So City of Spokane and then Spokane County will each get a cut of that here in our region. And so the $5.5 million it created this piece of legislation and created this pilot project that we've been operating as for the last 2 years. And we used $190,000 of that to pay Washington State University, an incredible local university here in our region, to do an independent study of our outcomes. And what we asked them to do was, we had 3 goals, and that was to look at the rate of neonatal abstinence syndrome in our region, the outcomes for our moms or for our parents, because we do have dads stay here, and then to look at the outcomes of our infants. And so they looked at those outcomes. If you go back to that slide, what it showed was the rate of neonatal abstinence syndrome in Washington State in 2022, because they could only find data through 2022, was 180% the previous year's national total.
Where was that slide at?
Keep going. There, next one. There we go. So
This one right
Washington
here?
State, previous one. There you go. So Washington State in 2022 was 180%. So it was more, almost, double the national rate from the previous year. But in Spokane County, our rate was 340% the previous year's national rate. So it was almost 2.5 times worse. And so, and then on top of it, there was no data for the last 2.5 years.
Right.
So and it doesn't take our community, our Spokane region has been very, very deeply impacted. We have a fentanyl crisis here in our community. The DEA has named Spokane as one of 11 cities in our country that are hotspots for fentanyl use, that are disproportionate to elsewhere in the country. And so this data doesn't take into account the fentanyl epidemic that's hit our community in the last 2 years. So we're fighting a war with 2.5-year-old data.
Right.
How do we do that? So if you flip to, I think it's the next slide there. So in the absence of better data, we started looking at, what were monthly EMS responses. Those had doubled between 22 and 24. Overdose deaths had increased, 162%. The most recent data that we were seeing was that fentanyl-related deaths here in our region were 15 times higher in last year than they were in 2019. So, I mean, we just sort of extrapolated that and figured that neonatal abstinence rates, impacted births had increased in our regions. So if you go one more slide, something else that study came back and showed was that our community is seeing more polysubstance use. So that's use of multiple substances at one time, which are having really negative impacts on both maternal and neonatal care. The efficacy of it's leading to additional interventions being needed, longer courses of treatment. So if you flip to, can you see the slide that's got several different, keep going,
Where it's the different
the different
substances.
substance exposures? Yes.
That's the
Um,
slide that almost made me cry.
so
Here it
that
is.
just about knocked
Yes.
us over. So what that showed,
Hmm.
they looked at our first, I think this sample size was our first 70 infants. And what this showed was that on average, each of our first 70 babies had been exposed to 3.7 substances each.
Incredible.
One of them had been exposed to 8. So when you think about the fact that many of our babies, methamphetamine withdrawal and withdrawal from opiates look very, very different. So what happens when you have a baby that's been exposed to both? Maybe there's some methadone in there, alcohol or tobacco. It could be things even just as mundane as caffeine or nicotine, antidepressants, those kinds of things. Neonatal abstinence syndrome covers all of those. It's any substance that a baby would withdraw from. So
Okay.
when you have a baby that's been exposed to these very different substances that cause very different withdrawal symptoms, you don't know at what gestational age they were exposed, for how long, in what combination, and then you throw some biology in there, it's an absolute grab bag what you're going to get. So it's no wonder that our hospital systems, our medical providers are struggling to figure out how we support these babies.
Yeah. This chart in itself, I messaged my sisters this morning and I was like, I think I'm gonna have a hard time not crying through this interview.
Yeah,
74 or 75% of the babies are born addicted to fentanyl.
yeah.
Fentanyl, like
Hmm.
methamphetamine.
And so often we were actually very surprised. We thought because of the fentanyl epidemic in our community that, um, we would see fentanyl as the number one exposure. So we were a little surprised to see methamphetamine. But what we're finding is that so often it doesn't matter what substance you're taking. If you are not getting it prescribed from a doctor, it's going to be laced with fentanyl.
Yes.
We are seeing so many deaths in our community because, overdose deaths because somebody thought they were taking one thing and it was laced with fentanyl.
Yes. Yes. And
The thing that I heard was that, if you think about a little sugar packet, you're going to put in your coffee or your tea, that amount of fentanyl would be enough to kill 400 people. So if you think about the fact that like the dust of fentanyl on something else, could be a lethal dose.
yes.
It's no wonder that we're seeing what we're seeing.
Yeah, it's everywhere. We live in the Chicagoland area. We're in the suburbs, more into Indiana, getting a little bit rural. But the closer we get to the city of Chicago, as I'm driving to Chicago to do whatever I'm doing, it's you see it. You see people, and a couple episodes ago, for the second time, I had a local mom on. Her name is Jill. And she's a huge advocate. She was a user herself. She actually lost her arm to heroin use and just lifelong effects and things like that. And her big message that she has said on the podcast is you cannot experiment. I don't know how old you are. I'm in my 40s. You could smoke a little weed, not a big
Yeah.
deal. I never went
But it but
beyond
it
that.
but it also wasn't what your parents or grandparents were smoking back in the 70s. You
No,
know,
no.
you're seeing purple dragons and that kind of thing, depending on what you're getting into now.
Well, yeah, and that's what's really scary is that you cannot like, and I want to pound that into. I have preteens and teens now. You cannot mess around. You cannot like you know
One time
hitting
is all it
somebody's
takes.
pen now. You don't
Yeah,
know if that has fentanyl in it. You
yeah,
like you cannot experiment at all as the boomers and the millennials
yeah.
could a little bit, not that I'm advocating for that by any means, but um it's become so scary that
Mhm.
you don't know is what substance you're actually taking. And
Yeah.
I've even heard stories of, kids on college campuses thinking that they're taking like Ritalin or like,
Mm-hmm.
things like
Yep,
that. And you just can't mess around.
that
So,
is not uncommon.
yeah. So when it comes to these babies being born addicted to multiple different substances, as you're looking at that list, some of those are uppers, some are downers, some are,
Mm-hmm.
whatever, that makes the care so complex
Yeah,
that you're dealing with layers of withdrawal. Some things they're withdrawing from faster, some things are making this, some things are making that.
yeah.
So,
And some of these infants will go on to be perfectly typical kiddos. They won't, maybe they struggle in the beginning and then, they're gonna get through this and they're gonna go on to be happy, healthy kids. Others are going to experience lifelong impacts from this. So yeah, we recently, just this last summer, connected. We had, again, thanks to our amazing social media, had a brand new organization called Generation O reach out to us. They just received their nonprofit status in, I think, June of last year. They reached out to us and said, "Hey, we would love to connect." We had never heard of them, and we are fast friends now.
oh,
um, they started as a private Facebook group for parents and caregivers of um, ex- children that had been exposed. And, it was everything from, um, infants, brand new little babies, toddlers, all the way up to teens and adults. And it was this basically private support group for parents going, there are no support services. We adopted this baby, or we are have we're fostering this baby, or something like that, that we just have no idea how to help them. There are no resources available. Our doctors don't know what's going on. Um, you know, Doctors nowadays get very little, if any, training around the signs and symptoms of neonatal abstinence syndrome. And so these parents were going to their doctors just begging for a diagnosis of autism or ADHD just to get their kiddos connected with some kind of support services. Um, I heard somebody say that neonatal abstinence syndrome is an infant's diagnosis. That after the age of 12 months, there's no medical code to plug in to say, this has been this baby's experience, and this is, as an adult, you can get diagnosed with ADHD or autism or whatever. And there's going to be some kind of medical code that says, here's a
right,
pathway for
right.
services, right? That, as far as we know, doesn't exist for kiddos that have been exposed. And so they ended up creating this. They turned it into a nonprofit. They were passionate enough about it. And while their group is not providing direct services like the nurseries are, um, they are sort of the educational arm and advocacy arm for this population of folks. And so they are actively looking at research and studies internationally, all over the globe. Any kind of information that they can get their hands on, that they can then, translate from these really clinical academic articles and medical studies and that kind of thing. How can they translate that into everyday language that they can offer some kind of information or support for families that are impacted by this? And they're offering it completely free. If you go to their website, I think it's generationo.org. Um, it's all free, and they're keeping up to date with the latest research and that kind of thing. And so we were lucky enough, they got a grant last year and had an opportunity to travel across the country. I think I mentioned this. Maddie's Place is one of only 5 nurseries in the country
Yeah,
that do
yeah,
this. And so they were able to travel around the country and meet with the different nurseries. And we've created, sort of informally, this coalition where we come together to talk about, what are we doing? What are you doing? How do we work together? What's working for you? Um, just to see how we can support one another and help advocate on, local and state and national levels, for families that have been impacted by this.
Yeah, and I was thinking as you were talking, another great like connection I would love to see happen. I mean, I would love a Maddie's place in the Chicagoland area. So needed. But
So
um
that's actually why we're trying to get Medicaid amended, because
yeah,
not only does it provide better outcomes for baby and parent, we can do it at a literal fraction of the cost. If we can get that reimbursement piece set up that we know we will be able to pay staff to fund these. We have people all over our state ready to stand up these buildings. They will invest in the land. We
beautiful.
post a position and in one day we receive 50 applications. We can find the people, we'll find the building, we'll find the property. We just need to know that we'll be able to sustain our services. We are ready to go and stand these up all over Washington. While we're doing that, our we've had some videos. I think probably one of the ones that you came across has gone viral.
Yes.
Went viral about a month or 5 weeks ago, and we have for the last year or more have had people reaching out from across the country, going, "How do we get one of these? How do we start one of these?" And we are preparing some materials. We are preparing, trying to figure out how we can. Does this look like some kind of packet that we can send out? Can we do some monthly um, meetings, Zoom meetings, where we can just teach people how to do this? We don't want to charge for it. We want as many of these clinics to be stood up around the country as possible, because it shouldn't just be, Washington and Ohio and West Virginia. We are the only, well, West Virginia and Ohio are the only states in our country that have amended their Medicaid plans to cover these services. Luckily, I know you're in the Chicagoland area. The nursery of the five that Maddie's place is most alike is called Bridget's Path, and it's located in Kettering, Ohio. It's just outside
Okay.
of Dayton. We are very, very, of all five nurseries, the most similar in size and budget and model of care and that kind of thing. So there is one for people in your area that are looking. It would be a
Probably
distance, but it's
5 or
not all the
6
way.
hours, but worth
Yeah,
it.
it's not Spokane, right? We
Right,
had
right.
a mom that had stayed here. She's been discharged probably 5 or 6 months now. That lived here in Spokane, had a young son, had just given birth to a daughter with some medically complex needs that had been exposed. And that's the other thing. She was on methadone. It's even though she was technically in recovery on methadone or Spoxin, that is an exposure for baby that can result in NAS. She had found one of the clinics. There are two clinics in Arizona, and she had found one of those clinics and was preparing to leave the Spokane area, leave her 5-year-old behind, and travel there with her new infant, and get the treatment that her baby needed when she found us on social media. And she said she was just thrilled. She didn't have to travel out of the area. She could stay here in her community, have visitation with her son, see him whenever she wanted, that kind of thing. That is what we want. We want to make this accessible for people.
Yeah,
So
yeah. And
we're
I would
working
love
on it.
to
We're working real
see.
hard.
Yeah. And you know what? God will feel that, hear that, know that. He will answer those prayers. I know he
Yeah.
will. And I was just thinking, just the connection to even like pregnancy centers, if
Yes.
you, if we could work together as a community to these women come into pregnancy centers, they're scared, they're looking for help, they're lost, connect the pregnancy center to a place like Maddie's place, or if we had support from churches. Like I was just thinking outside the box, like even if we didn't have a center set up like this, if we had churches that offered these services to the best of their ability,
Yeah.
there's so many.
There's so many ways that people can support. I think, the clinics that are open and available, if folks have the capacity and it's on their heart to make a donation, to help with operating expenses. I know all of them are writing grants and fundraising. They're working so hard. But most of them rely on donations and that kind of thing. If you can volunteer time, if there are volunteer opportunities, I know we have talked, and I actually just got to hire and onboard a part-time volunteer coordinator this week. And so we have such a tiny little admin team. We really haven't had capacity to bring in volunteers on a really sustained basis. We do have some cuddlers. They just come in and cuddle babies,
So
and be an
jealous.
extra set of hands in the nursery. Um, but if it is, lawn care or cooking classes, so many of our parents have come from backgrounds where they've just survived on food that's convenient and available. They haven't been taught how to meal plan and go grocery shopping and come back and prepare those foods. Or if they're accessing a food bank or a little free pantry, a parent that's had all their teeth pulled, they're not going to reach for the apples. So how do we, or carrots or something? How do we prepare those foods in a nutritious and really delicious way? If you know how to cook, if you know how to sew, if you have a hobby, if you like to paint, um, if you can just be a natural support after a parent has left services like this. Many parents are coming from out of the area. They're coming from other places in the state, but they recognize that they have a support system here, and so they stay in our area. Um, but they don't have, when they get sick, they don't have a parent or a friend to call to watch baby, or, they don't have a car. And what if they need to make it to an appointment that, the bus doesn't go there? So, or they just, something comes up and they just need somebody to talk to. Being that natural support for somebody um, can make a world of difference to them. Just be a friend.
I love
Yeah.
that. So I think that's a good place to stop, because I feel like we could talk for hours and hours and
Yeah.
hours. Um, is there any, I guess what's on my heart is if someone who is listening knows someone or they are someone themselves that they're in this situation, they're either they are pregnant themselves or their spouses or someone that they know, like what advice would you give to them?
I think the most important thing I can share is approach with kindness and care. Open up, reach out, offer support in whatever way feel like you've got capacity for, in a non-judgmental way. Come from love, let them know that they can do this. There are services available. They have worth and value as a human being, and their baby needs them.
Yes.
And it's going to be terrifying. It's going to be scary. It's not. It's going to be hard. Getting into recovery is not a linear path, but it is doable. And there are people that don't even know them that want to love and support them. We're cheering them on. Pick up the phone and make the call. See what services are available in your area. And if you are, a provider, if you're a medical provider, again, approaching parents with no judgment, that many of them live with the guilt every single day. They don't want to be doing this to their baby. This is an addiction. Making sure that they feel welcomed, making sure that they feel listened to, making sure that they know they can come get the prenatal care that they need, is going to be so important.
Yeah. Yeah. Love that. Katie and everybody at Maddie's Place, thank you for what you do. Thank you for the light that you are in your neighborhood. And we'll be praying for the Medicaid approval and the funding. And if you guys are
Thank
listening and
you.
you want to reach out, they have the cutest Instagram account on the app. I promise you're going to love it. I love following you. And if
Thank
you're
you.
able to support financially, that would be amazing. But if nothing else, pray and pray and pray. And all right, we'll see you guys next week.
Thank you so much.
All right, bye.